So I want to rewind a year, and at least early on in the pandemic, and just talk about what did it look like? What information did we have? What were we missing? And what did we need to fill in pretty quickly in order to start to address some of the challenges that the pandemic would deal us?
Yeah. I mean, the pandemic has exposed major data gaps when it comes to pandemics from the very initial stages to even today. At the beginning stages, we focused a lot on early detection of outbreaks. So my other hat, other than chief innovation officer, is I'm a professor at Harvard Medical School, run a lab that has been focused on public health technologies for many years. And so we've been involved in early identification of a range of disease events like H1N1 and Zika. And in this case, we definitely identified in the end of December something that was going on in Wuhan. December 30th, we sent the first alert of something unusual happening, but clearly something was brewing for weeks, if not months ahead of that. And we didn't have the right technologies either at a global scale, but probably not at a local scale either, to identify that aberration in symptoms or emergency department visits that sort of delayed our ability to track this virus. And whether that's because we were limited by access to these kinds of, whether it's individual level data on symptoms or because we don't have the right kinds of diagnostics in place, we were challenged. So we already, out of the gate, we were already delayed. Then from there, like being able to track this virus as it spread around the world, I mean, we built this international network of volunteers that were contributing data from various parts of the globe to sort of pull together our sort of a global understanding of what was happening with COVID. Again, this was a network of volunteers because there was no sort of real global body that was really focused on pulling these data together and giving that sort of global picture. And then, of course, when the virus hit the shores of the US, we were pretty data blind. We didn't have good surveillance systems around symptoms or cases. Of course, we didn't have the diagnostics. We didn't have understanding. We ended up launching a platform called COVID Near You, funded by Google, which ultimately allowed us to fully uncover some of the emergence events of COVID in communities because we had no ability to test. Now, eventually, the systems caught up, more testing. We started getting feeds of hospitalization data, mortality data. Eventually, all those things became more commonplace. But again, like we go to like the Johns Hopkins websites or the COVID Tracking Project or COVID Act Now. Like these are all efforts that are de novo, and they aren't really government efforts. And there's a big data gap in what government agencies are providing today in terms of a real-time visibility. We're challenged in this country because of the way that public health is set up. And so it makes sense that it's hard to give a national picture in real time.